Hi, this is Vivek Pradhan, a psychologist and a counselor, and today I'll be speaking on the basics of counseling. So, what counseling is? Counseling is basically used in cases where none of the medication works. Like there are people who are suffering from lots of different illnesses, but sometimes there are situations where none of the medicines work. So, they don't know what exactly is happening to them, what exactly is going to them. That's where counseling starts playing its role. So it's basically a normal conversation between two persons. The person who is sharing the problem is counselee, and the person who is actually helping is called counselor. So, but most of the time we call our counselee as a client. So we try to differentiate between counseling client is same, but we tend to use more client than counseling. Okay, so after like definition of counseling, what we need to see the basic qualities of a counselor. Okay, the first and foremost is you should have a positive regard. If you yourself are very negative, you are very pessimist, probably you might not be able to counsel a person in a perfect way. So for that, first of all, you really need to be very positive and optimistic. Second is you really need to be very open, non-judgmental, and you need to accept the person the way they are. Okay, and see, basically you really need to be open. You cannot expect a very introvert person to counsel because the person himself is so reserved. So it's very difficult for them to come up with like helping the some other person. So you really need to be very much open. You really need to be very caring and empathetic also. You should be able to put yourself in others' feet and see what exactly it feels when you are going through such kind of problem. So empathetic is very important quality of a counselor. And of course you should be able to know what exactly the case is. When a person tells you okay that he or she is actually suffering from anxiety, you should be knowing the basic concept of anxiety. Okay, you should not know anything about anxiety. So how will you going to counsel the person, right? So you should really need to have a basic knowledge about everything, most of the situations, especially disorders also, and especially now where the situation of COVID-19, most of the people are suffering from anxiety. Okay, so you really need to be culturally sensitive. You need to be very patient, and one very important quality is good listener. You should be a very active listener, because a small detail, if you miss a small detail also, you'll be playing with your client's life, because during a counseling each and every details matters. Okay, and you should have the ability to maintain a confidentiality, and you should be objective and having clarity also. Okay, so when you look into the process of counseling, the first and foremost stage one is relationship establishment. So in relationship establishment is, what exactly relationship is, right? A bond between two persons. So in relationship establishment, you try to make your counselee or your client very comfortable when they first enter the office. Okay, what we need to do is rapport building. Okay, that's what it's called. You should be able to make a client very comfortable, so that you can gain that trust, so that your client is very much open enough to share their problems. So the moment you get that trust from your client, they'll be keeping on going on and on telling their problems to you. Okay, and in between situation comes where you need to use a technique called leading. Okay, leading is basically the kind of things like like you just shake your head, or you make like some kind of sound like such kind of things are called leading. And in between sometimes silence, when you just keep on, you go lean forward and just try to listen. You just keep your mouth shut and you just give that silence to the person will go on and start giving their thoughts to you. Other is acceptance. When a person is trying to share you, okay, I had a very bad dream. So, okay, oh, you had a very bad dream. Okay, I can understand that. You should be able to say these things. Restatement or paraphrase is also one thing where you actually, restate. Or when a person says, I actually had a fight with my friend which was very traumatic for me. So you should be able to, oh, you had a fight with your friends. Okay, I can understand, it must be very traumatic, right? Okay. So such kind of words actually helps the client to, open up more easily. Okay, and that's all comes into as a relationship establishment. When you look into step 2, that is in-depth exploration. Okay, in in-depth exploration, there are times where you really need to find out what exactly is going on apart from what the person is telling. So there are situations where you have to go around and get information about the clients and from their friends, families. Okay, I do understand it's very confidential thing, but yes, there are situations where you really need to get details from other phases of the person's life, so that you know what exactly the person is doing is correct or not. Because there are situations where lots of clients comes and they just cook up some story to you. Okay, so for that, in-depth exploration is very much required. So once the in-depth exploration is required, once the in-depth exploration is done, you have got lots of information about the client. You know what exactly the person is going to. Whatever the person is saying is correct. Whatever your client is saying and whatever information you got from other person is correct, then you get an idea. Okay, oh yes, so this is what is happening to a person in your client's life. And that's where the last step comes, that is okay, one more thing. There are situations where you really need to do some kind of assessment test also. Sometimes there are lots of diagnostic test or interview or psychometric test where it's very much necessary that your client goes to it, does that, and you have the result, so you will get a better clarity about the client's personality also. And in the last step of counseling, what we have is commitment to action. Okay, so in commitment to action, what happens is you know what your client is suffering, you know what exactly the problem your client is facing. So what you do is you sit along with the client and chalk out a plan. Okay, try to see where are the various aspects of life which needs to be improved, so that the kind of behavior modification the client needs comes out because of that particular step. See, again, what we need to understand here is you are not supposed to give your ideas to the person. You should always let the ideas come from the client side. Okay, like for example, if a client says, oh, I'm having lots of stress, so you should be able to say, okay, I understand you are going through lots of stress, so how would you like to deal with this? See, because every person is different. Okay, so you should give that what is that called, you should give that opportunity to your client so that they can come up with some kind of solution. Yes, there are situations where the clients are kind of they are very numb, they don't know what to say, they are just lost, they don't have anything to say. That's the time, yes, you can support them, help them out, giving some kind of suggestion. You are not supposed to give any kind of advice to your client. Okay, please be very sure about this. It's against the rule of counseling also. It's very much important that you really need to avoid giving advice or do not implement your thoughts on your client. So let the idea comes from your client side. Once you have planned out or have chalked out the plan or the kind of behavior modification the client needs, let the client try to adopt such kind of behavior and let the client go out and see how the client feels. Once the client feels good and the person is able to see the changes in his life, it's well and fine. That's where the counseling ends. But yes, again, after having all that thing, after all the behavior modification, also the client is going to some other kind of problem, is still facing the problem, then again you need to come back and start doing the same process again. Probably you do not have to do the rapid building and like rapid 1 or 2 step, the first 2 stage, but really you need to focus more on your 3rd stage. So that's where the process of counseling ends. Okay, so when we look into the ethics of counseling, please be very sure one and fundamental ethics of counseling says confidentiality. So whatever your clients comes and tells you, it has to be very, very confidential. Yes, there are situations probably you might have to go back to your like someone for like superior to you for a supervision. That's very important. But other than that, please make sure that whatever you talk, whatever you or your clients share to each other, it's very confidential. If you are taking some kind of supervision, please let the person knows about it. What exactly I do is I always ask the person to like sign a bond before the counseling starts. So these are the few of the things which you really need to understand. So that's a basic thing about counseling. Okay, if you want to do an in-depth study, yes, there are lots of things we really need to understand, but this is a very shortcut and a basic thing on counseling. Thank you.